Hi everyone, this is Dr.Ali Gosnell from Reshape Physical Therapy here in Winchester, Virginia. This week we're going to talk about hypermobility. And you could have hypermobility of one segment, you could have multiple joints or segments, or you could have a whole body that has hypermobility. Usually when it's your whole body that has hypermobility, or all of your joints that have hypermobility, usually is associated with a medical condition. Now, what is hypermobility? It is when you have excess or increased movement of a joint. So let's take, for example, your shoulder joint, okay? Here's the socket, here's the ball that goes in the socket. Normally, because you have a ligament that attaches your bone to bone there, they stay pretty nice and snug with not tons of movement, except for when you purposely go to move it. When you have hypermobility, you've either overstretched the rubber band, which would be the ligament, or you have collagen that's very elastic, meaning that it stretches really easily. And that causes increased mobility in that joint and can cause some issues. Some things that people might experience if they have a segment, multiple segments, or whole body hypermobility is that they can have pain, stiffness of joints or muscles. Usually it's muscles surrounding that joint. Could also have a sprain or strain. Usually they're repetitive, so if you've heard of people rolling their ankle repeatedly, that's a repetitive ankle sprain. It usually deals with some hypermobility of that joint. You could have had an event that caused a dislocation or subluxation of a joint. These people usually, not just a dislocation, in general hypermobility, usually experience decreased balance, meaning you feel unsteady on one leg, or decreased coordination. For instance, you might have difficulty walking, throwing a ball, other things like that. Some other things that people experience, specifically people who have a medical condition that causes the whole body hypermobility or joint hypermobility, is that they could have stretchy skin or thin skin, which is where if you were to take your forearm, pinch and pull, mine's pretty firm, but for instance, people who have Ehlers-Danlos syndrome or Marfan syndrome, their skin is very elasticy, so it stretches pretty far. These people also could have digestive or cardiovascular issues. So for those people, it's very good for them to see a specialist who works with hypermobility, because then they know how to work with those people and help manage their symptoms based off of their medical condition. Now, things that really help your joints, if you have hypermobility, is to strengthen. Oftentimes people feel because of that stiffness and that pain that they want to be stretched and they want to have massage. And those are good for temporary relief. But the thing that really helps people is if they strengthen. That strengthening helps those muscles stabilize that joint where the ligaments aren't doing it anymore. So stay tuned later this week for some more information on strengthening if you have hypermobility, and also stay tuned to see if there are any neuromuscular re-education things that you can do to help your body if you have hypermobility. Okay? Everybody have a great day. Have any questions, please send us a message below. Bye.